I mean, if I choose to speak very slowly, yeah, maybe. That's not my intent today. Plus, both chapters are more or less familiar. They are repeat or almost repeat up to 35 chapters of the same topic. So I'm not gonna invent the wheel here. So, immunity. First of all, what is immunity itself? The term.
It's like your body's ability to fight against infections or any foreign body.
Absolutely. Types of immunity. Two main types.
Passive
and active.
Those are subtypes of
Innate.
Natural and yes. Or you can say innate. That's what the human is born with all the abilities to fight, which includes ability to cause inflammation. Inflammation is the first type of response. Skin is very much filled with immunity factors. And acquired type of immunity is when we encounter either disease somehow or vaccine, or maybe antibodies, which is the pure type of immunity, B or humoral immunity, they're given to us. It can be done either via breast milk or through placenta or some vaccines. They are antibodies. All right, if you need to remember something from the slide, remember the word inflammation. Inflammation is the first line of defense when we speak about immunity. So if the question is worded, what's the first line of defense? What's he going to answer?
Inflammation.
Sorry.
Your ears.
Yes, the ears. Exactly. And recall 5 cardinal signs of inflammation.
Redness.
Swelling.
Warmth.
Heat. Not edema, but like.
Decreased function.
Oh, decreased.
Fifth one is decreased function. All those 5 correct. Please make sure that you truly understand those 5. I know we keep coming back to them, but guess what? So many conditions come with inflammation. And try to, in your head, practice. How would those 5 cardinal signs look with different types of inflammation in different organs? And what are the consequences? And what is the worst? For example, if patient has inflammation in the knee, arthritis, what is the most thing that is hurting this patient? What's the
Walking.
worst for them?
Walking.
Pain.
Moving.
So in the situation of arthritis, the worst thing is pain and inability to probably be as active. How about patient who has encephalitis? Inflammation of the actual brain.
Oh.
In edema, swelling. Most important, because swelling will increase intracranial pressure and will put patient at risk for herniation and death. So with each, practice yourself. We cannot cover this in the classroom, but just think different parts of the body and think, which cardinal sign is the most dangerous for this type of inflammation in this location and another location? And what is that I need to do in order to then assess and fix the problem? That's a good exercise, and it will set up your mind correctly. All right. Hypersensitivities and allergies. By the way, this chapter is, we're not covering autoimmune conditions. It's chronic. It was in 235. So, hypersensitivities. mainly talking about overactive immunity, when the response is more than needed for some reason. And the response is overwhelmingly high levels of inflammation. And all this is triggered by some kind of antigen. Here in definition, they mentioned the patient has been previously exposed, but sometimes it happens with the initial exposure. For example, patient never had lidocaine in their life. They go to the dental office, they receive the pain medication for their procedure, and here they are in anaphylactic shock. They never had this before. That's their first initial exposure, and here we have hypersensitivity reaction as anaphylaxis. So please remember that, or add it to your slide. It can be from initial exposure also. Degree of reaction can be either very mild or life-threatening. And please recall what is that is life-threatening and what's the problem there. Allergic asthma. What is the pathophys thing or step in the process that makes this type of asthma life-threatening?
What's the airway? Inflammation of your airway.
Yes, but what is happening in which part of that process?
The
Bronchospasm. Bronchospasm. That's why we're giving bronchodilators as a rescue med. You can say, well, how about inflammation? Yes, sure. What are we treating inflammation with? Steroids. Do they work instantly? No. So in this case, our point of application is to dilate bronchi, and that will improve the airway. Yes, the patient will be getting those steroids. They can be inhalation steroids, they can be IV, but they're not gonna work instantly. Bronchodilators work very fast, if they work. Angioedema, what's the problem there?
Their face, lips, tongue swells.
Swelling, yes, so swelling is there. It's not bronchoconstriction anymore, it's swelling. Anaphylaxis. Swelling, absolutely. Bronchoconstriction is a part of that. And circulatory collapse, what is that?
You get hypotensive, like a shock.
Yes, and what happens then?
Well then, yeah, you've got no blood going to your brain.
Yeah, like massive systemic vasodilation with very low blood pressure. If you need a tool to remember, and how I remember, collapse means loss of a tone. If something loses tone, think about blood vessels. They are not in tone anymore. They're atonic, kind of plegic. There's a term vasoplegia too.
I got to see that in real life on an ultrasound yesterday.
Did they get methylene blue?
No.
That is just FYI. It's not gonna pop up anywhere in the nursing. Even if you work in ICU, you might not even see this ever in your life. The same name is used for certain type of, it's a dye. It's bright blue dye, like Megan's coat. It's this blue. Or your bottoms of the scrubs. It's used to, for certain like microbiology coloring. But slightly different variation of it is used for IV infusion for the patients who are vasoplegic. For example, they're on 4 vasopressors, maxed out, and still blood pressure in 70s. So they're not responding for any vasopressor. Nothing works. So that, like, as a last resort, the provider may order that, and it works with nitric oxide in the blood vessels and increases their sensitivity to any vasoconstricting medications. And it is that color, so you're hanging and you see how that blue stuff goes in the patient's body. And then if they have fully, and they can actually excrete, their pee is coming out blue. Yeah, it's quite interesting. It's not experimental medication, it's FDA approved. It's just not known by many and not used by many. It should have much broader use. But, and the side effects are like, none. It is interesting. So, let's look at a few types of hypersensitivity. Type 1, rapid or atopic. Another example of atopic allergy is anaphylactic reaction or angioedema. The pathophysiologic process involves increased production and release of immunoglobulin type E, which is a type of antibody. There are many types of antibodies, so immunoglobulin E is a subtype of antibody. How allergens can be acquired? Through any route. We can inhale them, we can put them on the skin, we can ingest them, we can inject them, we can put them via rectum, anyway. Technically it does not matter. If one is hypersensitive to a certain substance, the reaction will be very fast regardless of the route. So these are 5 cardinal signs of inflammation. And the main word here is histamine. Histamine, do you know where it is in the human body? It lives in every single tissue within special type of cells. They're called mast cells. M-A-S-T, mast cells. They used to be called fat cells, but because they have nothing to do with adipose tissue, they're not called this way anymore. Those mast cells are, they belong to connective tissue subgroup. They are not nervous cells, they are not epithelial cells. They are not muscle cells, it is connective tissue cells, one of a million types of it. And those cells are filled with granules of histamine. So when one suffers allergy or anaphylaxis, that histamine is being released from mast cells in massive amounts. Cells do not die during that process, they just let things go, throw it out. And histamine is a massive vasodilator. Plus, it's super itchy. With vasodilation, what will you see if that's close to the surface?
Redness?
Redness, yeah, more blood vessels here, more blood flow in those vessels. What else will you see if there is better blood flow there? Swelling, warmth, yeah? With the swelling, there might be pain due to the pressure that is placed on nearby tissues and nerves, and decreased function.
So it's the histamine that causes all of those.
Yeah.
From
That-
the mast cells.
Yeah, and the medications that we're giving to patients who have allergies are antihistamines.
Yes.
Yes.
All coming together.
Yes. Antihistamine. Yes. So those medications prevent mast cell degranulation. They of breaking down of those granules that have histamine in them. Light bulb.
Like, yes, like I mean, it's bright. Good, see the light. It's happening.
So, anaphylaxis is medical emergency characterized by extreme vasodilation, and because all blood is sitting in the dilated blood vessels everywhere in the body, how much of it will return to the heart? Some will return,
No.
and because little returns, the heart can only pump out that little. So cardiac output secondarily to that. And bronchoconstriction as a part, but not related to cardiac output. So with anaphylaxis, and there will be a few more slides about that a little bit later. Now we're just jumping through the types of hypersensitivity. With anaphylaxis, there's blood pressure kind of problem with hypertension and also bronchoconstriction. Type 2 hypersensitivity reactions are cytotoxic. It's when the body makes antibodies against cells that were marked with a specific protein. Cells that are labeled by mistake or by on purpose. I'm sure that from farm you heard about cytotoxic drugs. Those are used, for example, in the case of autoimmune conditions like lupus, and we give the medication that has a protein in it that labels certain cells that's supposed to be bye-bye. Type 3, immune complex reactions. Good morning. Come on in. The best examples of type 3 is autoimmune condition. When without any notice, the body for some reason starts recognizing cells as non-cells. No extra protein, no extra agent, no extra anything is required for this mistake to happen. And type 4 delayed hypersensitivity. So that is from most of them, from previous exposure that might have happened quite a while ago. A very good example could be dermatitis related to hypersensitivity and delayed blood transfusion reactions. You know that when you do the blood transfusion, you cannot leave the patient for first 15 minutes, and then you keep checking the vital signs every half an hour, and then at the end of the transfusion, and then quite frequently, like every hour at least, at the very beginning. But you also know that other blood transfusion reactions may happen up to like 5, 7, 10 days post blood transfusion, and that would be this type.
How many days you said post what?
Up to 10 days.
Up to 10 days, okay.
Yes. A few words about angioedema. Is one of the examples of type 1 hypersensitivity. And the main problem there is the swelling of the face, neck, throat, around airway, and that's the problem. And you remember that the most dangerous group of medication that can cause that is ACE inhibitors. If patient develop angioedema, taking ACE inhibitor, this patient cannot ever, any day throughout their life, take the same medication or any other medication from the same group. You cannot switch enalapril to ramipril or ramipril to trandelapril. No pills forever. What can you substitute ACE inhibitors with?
NSAIDs?
Calcium channel
Uh-uh.
carbs.
Yes. Okay, so within the history, you just need to, MBACs will ask you only one question. What do you need to ask your patient about? They can communicate. If they developed angioedema, did you take ACE inhibitors? That's pretty much one question.
Is it NCLEX? Multiple choice.
Oh, it's both.
It's what?
Both. Multiple choice and select open.
No.
Okay, is it type in the answer too? From that?
No.
So you said they can never take what?
ACE
ACE
inhibitors.
inhibitors.
Yes. Froze. Yeah, that's like 35%.
That messes with my anxiety.
It's what percent?
Like 35%.
No.
It's a denial.
That'll help us.
Previous cohort that just graduated, so far 100%. And more than half already registered nurses. Yeah.
That's a good thing.
So, yes.
Good for them.
And we only count the first pass. So I do not think that there is even one nurse who, I mean, within my 2.5 years here, who did not become RN eventually. We do not count the statistics for the second attempt. We only consider the first because that's how the schools are rated. But every single one passed. Second attempt, third attempt, I do not know.
25th attempt.
You know what? It's unlimited. It's not like for medical doctors. They have 3 attempts only.
It's
Here?
unlimited in New York. I don't think it's unlimited here in Maine, is it?
Yeah,
It's
it is.
unlimited.
It is.
It didn't used to be though.
Maybe,
It used to
but
be
right
like-
now,
It used to be like 10.
It used to be
Enjoy.
8.
well, you need to pay every time.
Yeah.
Yeah, you
no,
have to
pass
pay
the
every
first
time.
I don't care what I get.
And you cannot reschedule your second one.
And I think it used to
Right
be
away.
longer in between too, but now
Now
it's
it's
only like,
45 days.
yeah.
So you have
Yeah.
an unlimited.
Well, you need to restudy a little bit, right?
Well, I mean,
Yeah,
yeah, that makes
exactly.
sense, but I thought it was only like 30. But
Yeah,
we just take it again.
You can only take it 8 times a year.
Right.
Well, if you
Probably 'cause
consider
there's-
that period of time.
Right.
Yeah, there's probably not
between-
enough months.
Only 8 times.
Eight
It's
times?
just
It took one of my
year.
Oh.
It doesn't sound.
It took one of the nurses that I know at Acadia.
We're
like,
beaming with
7
confidence.
times.
No, I just.
And she's great.
She
She's
probably
a
had
great.
really
Like,
good
you
That's
can still be a nurse,
Oh,
you should take it 50 times, right?
Huh?
I said, you can still be a nurse even if you take it 50 times.
Yeah.
Yes.
Just
Some
don't
people
tell
are just
anybody.
really bad test takers.
Some people just
Yeah.
like, the nurse that had to take it 7 times didn't tell anyone she was taking it, so she didn't have to keep saying I failed it, and then
Select
she's a
all
great
failures.
nurse now.
I
Not at all.
was ready to be done with MCLEX and redo it, and with NP exam, I felt, I am usually the person who repeats things,
Mhm.
and I come back. So I was like, okay,
Not this time.
maybe I will,
You're a beast.
I will just see how it's made, what it's
Ah.
built of, and that will be my experience. I will consider that, it will help me to study better.
Yeah.
So I'm kind of preparing myself.
How many-
It's not the correct way to do it, but it was how I perceive myself.
How many times did you get to take it
Oh,
for
one.
NP?
One.
Or you only take it once, or like what's,
Oh, you can retake it.
okay,
She only needed
the
one.
2 months period
for NP?
Yeah.
Yep.
I said, you're a smarty pants.
Yep.
And then I take it once.
If I show you, I think I have the prep book for NP exam. I can show you what you need to know, but you need to know like every word out of it and understand it. If you wanna look, I have it with me. It's like this small,
Wow.
less than 200 pages.
Oh, okay. I thought we were trying to do that.
You say that till you open the thing.
But you need to be able to manipulate that information.
It's gonna be like the longest word ever on the first page.
No, it's all good. I will show you. The one that I use for exam, and it has all information you need. It's like this, nothing else you need.
Wow.
It's quite, yeah, it's very handy.
They should do that for the
What's it
answers.
called?
I'm sure they do.
Yeah,
Probably
let's
should.
let's get to the business here.
Is it NP for dummies?
No.
Oh,
Simplified and
So what are you going to do for the patient who has angioedema?
Protect the airway.
Protect airway. How?
epi?
Maybe they need to be intubated.
Maybe at intubate.
And it's
Intubate and then epi?
Intubate. And depending on patient's blood pressure levels. And with angioedema, it can be quite a challenge because the patient is awake, alert, and oriented. And you come to them and saying, it looks like your head, neck, and body became one, because it's literally like one swelling. It's life-threatening right now. You hear this about yourself, just for a second, and then we're gonna put the tube down your throat to help you breathing. It's not anaphylaxis with acute bronchospasm when a patient stops breathing and just like they change level of consciousness because of the acuteness of the situation. They do not have that much of a time with anaphylaxis. With angioedema, it's fast but not as fast.
And don't you want to get them intubated before the swelling gets too bad? Because you can't get
Usually they come when it's too bad.
Okay.
Yes, you do want to do it as soon as possible.
So do you have trouble getting the tube down because of
The provider might have some difficulties, yes. So, other approaches to angioedema treatment besides intubation?
Antihistamines.
Antihistamines, what did you say?
Stop the madness tonight.
Stop whatever caused it.
Yeah.
So if patient is on enalapril, or they received enalaprilat, which is like precursor of enalapril, when we give it IV, and it's sometimes done for the blood pressure, then no more. And oxygenate them. Frequent vital signs check required. Anaphylaxis. Another type of hypersensitivity type 1. It is very fast, and it is it can be deadly. So what are we doing for somebody who has anaphylaxis? If I right now develop anaphylaxis, there is a bee here, and I'm not, but I am allergic to bees. The bees,
I'm looking for an EpiPen to stab you.
yes.
Airway epi or epi airway?
Epi.
Epi.
Because in
first.
that case,
Because you're gonna
epi
get
is
airway.
the treatment.
Oh, Epi.
So epi airway?
Epi, yeah.
But it has angioedema for anaphylaxis.
Angioedema is that picture that is, I do not know how it's combined, I never alter the slides,
Okay,
I only
so-
comment on them.
So only epi for bee sting, but not angioedema?
Because usually angioedema happens first slowly. Second, it happens after a patient receives ACE inhibitors. In 99.9% cases, ACE inhibitors are pills. It takes a little bit of time. Anaphylaxis happens almost instantly after the exposure. Patient receives lidocaine for the dental procedure, 30 seconds.
So what do they get for angioedema?
For angioedema,
Antihistamine?
they can give antihistamine, but they will intubate first.
Okay.
So, yes, EpiPen is the most important intervention for anaphylaxis. Where are you going to give Epi? not going to be IV drip. It's in the thigh, intramuscular. And under any circumstance, you should administer that in your own finger. Otherwise, you may lose a finger because it causes massive vasoconstriction and constriction of the veins and arteries. It will help with the blood pressure if it's administered in the proper location, but in the small finger, it will constrict every single blood vessel here, and it's not going to be any perfusion. It's going to be necrosis situation.
So don't accidentally stab your hand.
Yeah. Try not to.
Or the other person's hand when they're freaking out with the bee sting.
Right.
Yeah.
Yes. So, per guidelines, if you have a second person with you and that can help you with the patient, that second person should be holding the patient, and you would administer that after, because the patient will be agitated, anxious, thrashing everywhere, yelling, screaming, grabbing air because the airway is closing, and somebody needs to hold the patient, and you safely will administer it. Do not administer from like you're stretching as backwards. Do not do like this. This is not correct.
That's a dance move.
This is correct. So if the patient is laying here, go across their body and stop them in the thigh. And do not undress or prep. This case, you can skip alcohol swabbies. If you don't have one in the pocket, that's okay. You just do through the pants unless they're like ski pants that the needle will not go through. But regular clothing, we just go through the clothes. When somebody has history of anaphylaxis, what do they need to do for their life?
Carry it
And
always.
Carry a pen.
Stay away from the allergen.
Yes,
Don't go
if
outside.
they know what it is.
Oh, okay.
Actually know what it is and how many of those there are. And also know whether your allergy crisscrosses with other allergies. Because somebody might be allergic to shellfish. And now you think, okay, shellfish, iodine, very frequently they're allergic to latex.
Same thing with like tomatoes, potatoes, like that was one of the questions on the one of the quizzes.
I will tell you that all my
Yeah.
life, until I actually started cooking, in my head, tomatoes and potatoes were opposite. So
Yeah.
I considered those red things potatoes, and the ground things tomatoes.
That's okay.
That's
As long as
awesome.
they're related, they're both nice
It's-
shaped.
It's the
Mashed
pollen.
tomatoes.
I
We
mean,
just-
in my language, they
Mashed
have
tomatoes
different-
and gravy.
They sound absolutely different,
Yeah.
and
That's
it's
okay.
easy to differentiate. But when I studied English,
Potato, tomato, potato.
Yeah, they say with
Potato.
tomato, same thing.
tomato.
Tomato,
Yeah,
tomato.
yeah,
Delicious morning.
so,
Yeah, does not help. So also, these people need to wear either a tag or medical bracelet that specifies that what that bracelet is for. Like for example, patients with diabetes, frequently like type 1, frequently wear those bracelets too, but it says, my problem is diabetes, or my problem is allergy. So bystanders who encounter the problem, they know at least where to think, which way, and maybe research the patient's belongings and maybe find that EpiPen. EpiPen should be with the patient 24/7. So how many EpiPens should be in the patient's possession?
2.
At least 2. It's the barest minimum. Always with them. If they go to the theater, it should be with them. If they go hiking, it should go with them. If they go to school, it should go with them. If they sleep, it should be right nearby. So self-discipline is quite important. You try. What is that you have with you all the time as an object?
My car keys.
Phone.
Yes, phone. Okay, at any moment you have a phone. What else do you have all the time with you as an object?
A lighter.
Some people don't sleep with clothes on. not that many things that a person carries with them 24/7 all the time, right? But that one must become it. And it may sound like an easy recommendation, but it's not. They are expensive and they expire and they need to be checked and refilled too.
Forget your purse, you're screwed.
They also need to be, it's not NCLEX, but they need to be, the old ones, they must be returned to the pharmacy for recycling because they're very environment bad. And they're active despite being post due date for a long time. So if anybody takes it, they can actually cause a lot of harm if you choose to use it. Okay. So the worst thing that for anaphylaxis is airways, so ABC. If you're dealing with a patient with anaphylaxis in the hospital, what are you gonna do?
Call a code.
Airway, epi.
You're calling a code. Yes. But does your patient have epi with them here in the hospital? No, they don't. This is something that you need to keep in mind. In the hospital, when they come with their own meds, they must report those meds. Pharmacy will come and check those meds, or you if it's night and there's nobody nearby, and you put them in the patient's medication bag, label it with their sticker, and keep it in the med room. They're not allowed to have their meds nearby. Even if it's Tylenol, even if it's nitroglycerin, even if it's EpiPen. So, imagine you come in the patient's room and they have an anaphylactic reaction. What are you gonna do?
I'm gonna call code blue.
Code right away. That's the first thing that you will do. You're calling a code because, sure, do you wanna leave the patient on the bed with a closing airway and run somewhere, try to find that epi? No, you want to know, you want notify as many people as you can, including the provider, because it's going to be overhead, about this situation. You will stay with the patient, maybe you will sit them up, maybe you will turn the oxygen up to 15, you will do something for them. But then, within like 30 seconds, at least somebody else will come, and they can get that epi. Or maybe they can stay with the patient, you will get epi. But you need to engage somebody right away. And respiratory therapists will come. And IV drugs will be used, and fluids also for the blood pressure, because blood pressure will be dropping. Diphenhydramine, please remember, is not used, not recommended for elderly people. However, if that is the only thing that is in your arsenal, only thing that you have, then you can do it. For NCLEX, you cannot give it to elderly. And for NCLEX, elderly starts, FYI, at 60 years old. Against all the world, including the country where you live.
So 65?
In the world, elderly is 65 and older. But for NCLEX, if you see 60, that's elderly. So all your nursing interventions, if they have like a specialty sign for elderly or not for elderly, consider that threshold 60. 60 is old. All right. Now let's look at some case studies. I like this somewhat swoon.
Call the provider, tell them about, airway management, you're suspecting
Yeah.
angioedema.
Give them Benadryl.
Well, nobody's saying that that's the elderly person, so
Mild.
you may, but do you want to know what's going on with them? You remember a thing that is called periorbital edema? for patients who have renal dysfunction, that can be swelling of the eyes, periorbital edema. And they might say my lips are swollen, but to you, they look just like any other lips that come from recent esthetician's office. So you want the key and the key word here, get the history.
Mm.
Ask, have you filled your lips?
And they look bad.
Days ago.
Who did they do?
Maybe that is the reason why they're swollen.
Have you taken any ACE inhibitors?
Runny nose.
That's the one.
Yes.
Maybe
Well, maybe they
reacting to
got flu on the
Yeah,
top of that. Can one person have more problem than just one?
of course.
Yes.
Usually do.
Right now I have funny voice. At least this is how I hear it in my ears. It's not my real normal voice. Plus I have sneezes. And when I sneeze, I think I sneeze 30 to 40 times in a row. It's devastating. When I drive, I need to stop.
That's real life.
It's like face in a steering wheel. I've done that. So that's why I need to stop. So I used to.
B.
E.
Is this a select all?
Mm-hmm. Yeah.
B and C.
E.
B, yes, because we mentioned immunoglobulin type E increases with hypersensitivity. And why do you need C?
To differentiate between blood, oh, no, I got it, blood
Yes.
cells, to differentiate between different blood cells.
Yes,
It's-
that's correct.
It's what, is?
Yes, that.
Cells?
Yep. So,
Yay.
immunoglobulin type E.
Eosinophils.
Yes, and CBC was differential to check the levels of E,
Oh my gosh.
eosinophils. Okay? The test will not tell you eosinophils. It will trick you into the differential.
But immunoglobulin E.
Yes,
is
it's
your-
self-explanatory.
Yeah, is your.
So EME, that's what you need to do.
What medications are you on?
Have you taken ACE inhibitors recently?
No, but they can
No.
just from work. They have peanut butter allergy. Or peanut butter.
Oh yeah, it's
Oh,
the
it's the
same
same.
person.
Yes, it's a case
Story.
study.
Oh, okay.
And that is a CNA.
Someone poisoned him.
Did you make somebody a peanut butter sandwich?
Oh, jeez.
Latex, yes.
Oh,
Oh, yes.
yeah.
It gives you a hint, it's a healthcare worker. So what's the
Stupid.
problem?
Latex allergy.
Yes, but right now,
Anaphylaxis.
I can have a history of that allergy. Right now, patient is developing what?
Anaphylaxis.
Yes, anaphylaxis. Okay, what do you need to, what questions do you need to ask? We discussed that.
D.
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 You think D, yes, and that is a correct answer.
C.
A.
A, B, C.
Maybe E.
And B.
And
A, B, C.
A, B, C,
And
E.
A, B, C.
Yeah, maybe E.
A, B, C, E.
How old are they?
Why E?
Nobody's saying
I don't think she has angioedema.
age not stays.
Give them everything but Tylenol.
So oxygen, yes?
Yes.
Yeah.
IV fluids for the blood pressure, yes?
Yeah, it wouldn't hurt.
Epinephrine, yes?
Absolutely.
Benadryl?
Yeah.
Yes, because nobody said that they're elderly. Do not add extra information that is not there. Do you need Tylenol?
No.
Why?
Maybe later. No.
Why?
We give everybody Colo. Everybody says Colo.
No,
PRN,
no, not everyone.
almost everybody.
Go to ICU, and those who come with
A, yeah.
those who come with the color of the skin like the bright sun.
No, yeah, those people know. Everybody else, yes.
Yeah.
A.
Have you taken your time
Shrimp
off
is
today?
not the shellfish, right?
Katrina,
It's sad.
you can convince me of anything.
I was not aware of the power of my words.
A. A, big time.
Hey.
Oh,
Yes, absolutely.
That's too easy.
Stop.
C.
Say,
Yes.
Stop it.
I mean, keep it going for a good time.
No.